biggest discussions in women's health right now concerns the HPV vaccine to prevent cervical cancer. And Dr. Elizabeth Skinner is here to explain a little bit about cervical cancer and what the HPV vaccine does. So first, tell us a little bit about cervical cancer.
Sure. Cervical cancer is a disease that affects the cervix, which is actually the bottom of the uterus. It used to be that cervical cancer killed more women in the United States than anything else back in the early 1900s. However, with knowledge and understanding of what causes the disease, and with the implementation of Pap smears, we've actually been able to make a big difference in the death rate from this, such that it's 74% less than it was back in the early 1900s.
Wow, so that's a great improvement. So there's been improvements, but is this kind of cancer preventable?
It's definitely preventable. If women see their annual provider and get Pap smear screening, also talk about HPV vaccination. This is something that can be completely prevented from ever happening.
And just tell me a little bit more about the HPV vaccine and who it might be good for.
HPV vaccine is actually good for girls starting at the age of 12 up until the age of 26. It's also been FDA approved for boys as well. The idea is to try to immunize women and immunize boys, or girls and boys, before they have an encounter that could expose them to the HPV virus.
And if people want to learn more?
If people are interested in learning more about this, we are actually hosting a seminar on January the 26th at the Cancer Center at Forsyth Center, and we are going to be having a talk and a seminar question-answer session to review this information and help people learn more about this.
And is that free to everybody?
It's free, and there's food provided.
All right, sounds good. Well, Dr. Skinner, thank you so much for joining us. We appreciate it.
Thank you.